About 18% of adults, more than 1 in 6, say they are depressed or receiving treatment for depression, a jump of more than 7 percentage points since 2015.
And nowadays, there are several ways to treat it. One of them that's been steadily growing in popularity is ketamine.
Dr. Cody Wenthur joins us now. He is an assistant professor in the Division of Pharmaceutical Sciences at the University of Wisconsin-Madison. Doctor, thanks for being with us today.
Thank you for having me.
Let's start at the beginning. What is ketamine?
Ketamine is a compound called a dissociative hypnotic, kind of adjacent to the psychedelic family. It causes an altered state of consciousness, sometimes at low doses making people feel like they're having an out-of-body experience, and at high doses can actually cause people to go unconscious.
And what was it previously used for?
Yeah, because of that ability to cause people to go unconscious, it's actually previously and continues to be used as a very effective adjunct for surgery as an anesthetic.
And now it's being used to treat depression. How is that?
That's correct, yeah. So in about the year 2000 and thereafter, folks at Yale and other places started looking at its mechanisms for depression. And it appears that in contrast to other depressants, antidepressants, it works fairly rapidly in just a couple hours to days, and has an effect that persists for some folks for up to a week, sometimes as long as 2, with just a single infusion.
So is that growing here in Wisconsin, and how many clinics are there?
It's definitely growing here in Wisconsin and nationwide. I would say right now there's at least 10 groups in Wisconsin who have outpatient ketamine clinics. There's also a couple inpatient groups, and some of those have more than one location. There's places in Green Bay, Kenosha, Madison, Milwaukee that I know of that are actively working on ketamine infusion centers.
But you have to be referred to. You just can't go into the clinic. This is like a prescription.
I would highly suggest that folks go see a mental health care professional first to talk about their depression and symptoms, because reputable places will be looking for referral, and this usually is not the first choice. So these are often patients who have tried other things. There are other antidepressants like Zoloft or other SSRIs that work fairly well for a large number of people. So this usually is a referral situation, and for folks who have had difficulty finding a relief from other methods, because there are risks associated with those altered states.
Do we know how this works on the brain?
We do. We have some good ideas. So that's one of the things that my lab studies, in addition to others. There's a system called glutamate that we don't hear of as much as we hear about serotonin or dopamine, but it's really important for the action in your brain. And what ketamine seems to do is tone down that glutamate activity. And it actually causes sort of a rewiring and a reset phenomenon that often people refer to or feel is helpful for them. That's one of the mechanisms that we think is operative, but certainly there's always more to learn.
Do you see psychedelics being used in more clinical practices?
So ketamine is the one that's available for use right now. There's certainly more clinical trials and studies ongoing with psychedelics, things like psilocybin in particular, including here at UW. And those compounds are moving through the FDA approval process in so-called phase 2, phase 3 clinical trials to really see if they are going to be safe and effective for these kinds of uses. So the data still are being collected on that front, but it's definitely an area of increased scientific interest.
It absolutely is. It could be a big factor in the future. Doctor, thanks for being with us today. Very interesting.
Thank you very much.